Biowatch Medical introduces personal health monitoring services, a subscription service dedicated to people with medical problems who can benefit from a direct link to critical care specialists 24 hours a day, 7 days a week. Our critical care specialists connect to subscribers via a vital signs transmitter, which sends 2 channels of ECG to Biowatch Medical's clinical monitoring center. When pre-programmed settings or normal limits are not maintained, data is transmitted in real time to our critical care specialists, who take appropriate action to assist the subscriber. Should the critical care specialist at the clinical monitoring center determine that a subscriber's electrocardiogram or other physiological parameters have become abnormal, they will contact them to begin appropriate intervention. If the subscriber is unable to respond, emergency medical service personnel may be dispatched to their exact location utilizing an internal global positioning system. Family members and personal physicians may be notified as well. The Vital Signs Transmitter, a comfortable belt worn around a subscriber's torso, houses a sophisticated micro-miniature monitoring device that contains a microprocessor, interpretive software algorithms, cellular modems for voice and data transmission, and a GPS locator. With our clinical specialists continually monitoring heart conditions, early detection of myocardial infarction or heart attack is possible, thereby allowing preventative treatment to be administered. Unlike other ECG monitors, the Vital Signs Transmitter operates without the use of external adhesive wet gel electrodes that can cause skin irritation and require replacements every day. Currently, there are no equivalent competitive services available to the general public or medical community that compare to the personal health monitoring services and Vital Signs Transmitter. The market potential for this type of product and service is astounding. With more than 4,000 heart attacks occurring in America every day, there is a strong need for this type of preemptive care. In fact, world-renowned electrophysiologist Dr. Mark Josephson speaks to the importance of time in a cardiac event in presentations he makes across the nation. He notes if those at high risk can be identified and early detection of the symptoms of heart attack can be monitored, then sudden cardiac death can be successfully prevented. In addition, top electrophysiologist Dr. Hein Vellens has written a paper regarding preemptive heart care. Entitled Cardiac Arrest Outside of a Hospital, How Can We Improve Results of Resuscitation? Dr. Vellens also emphasizes the importance of time in a cardiac event. He proposes the answer to this question be solved by developing a device that recognizes cardiac arrest, sounds an alarm, and transmits the location of the victim, shortening the time interval of the different steps in the chain of survival. The personal health monitoring services from Biowatch Medical, working in conjunction with the Vital Signs Transmitter, are designed specifically to meet both Dr. Josephson's and Dr. Vellens' points.
I've tested the Vital Signs Transmitter and the monitoring service on my patients, and I highly recommend it.
I can now go anywhere I want and do anything I want. With the Vital Signs Transmitter and personal health monitoring service, I feel my critical care specialist is only a phone call away.
We decided to get my husband the Vital Signs Transmitter and signed up for all their services. Now I don't have to worry about him all the time. Their professionals are doing that without interfering with his work or play.